Tracey Campanini is Deputy Secretary of the Office of Child Development and Early Learning with the Pennsylvania Human Services Department. Thank you for joining me.
Thank you, Phil, for having me today.
Now, the department recently updated its guidance regarding mask wearing in childcare facilities. Why was that necessary?
Well, the Office of Child Development and Early Learning, or OCDEL as we're known publicly, really does take its guidance in consultation from the information that's coming back from the Department of Health. And they're very focused on data and understanding how community spread is occurring with COVID-19. And so as they made their executive order announcement for the universal requiring of face coverings, that really does also apply in childcare for both the staff and the children. So understanding the guidance from the Department of Health and that does in fact apply to our childcare settings, we wanted to update and provide guidance and communications to our childcare providers.
Now, certainly children are not, sometimes some children like to wear masks, some may not like to wear masks. How should childcare professionals deal with children maybe who don't want to wear masks?
Well, that's a great question. So let me start with no child under the age of 2 should wear a face mask or a face covering. And there are also certain circumstances that would also exclude other children that might developmentally not be able to wear a mask or have a health condition beyond that age. And those children are excluded as well. One of the things that first and foremost is families and parents are children's first teachers, and their work that they're doing about children wearing face masks as they're going out perhaps for groceries or to run errands. Mom and dad or grandparents or caregivers talking through mask wearing with their children is a great educational opportunity. When children come into childcare, the childcare teachers or the staff that are working with them in the childcare center can do a lot of activities. They can demonstrate on classroom stuffed animals and talking about, and really it's amazing how much children at very young ages understand about the idea about wearing a mask. My mask protects you and your mask protects me. Young children get that concept very, very quickly, and they're excited about their role in helping keep others safe.
Now, you mentioned that some children could be exempted from the mask wearing. Is that a formal process? Do parents have to apply for an exemption or a waiver?
They do not. They need to talk through, and certainly if their child has a health issue, that should already be known to the child care provider. As we understand the impacts of COVID-19, many families have decided that their children should not return to care right now, and they either are teleworking and working at home with their children with them in their residence, or they might have made other arrangements for their children. But having that conversation between the family and the provider to be able to talk through those issues. And then child care providers are really looking at how to adapt the schedule of their day. And they're looking at ways, even with mask wearing, how they can arrange opportunities for children to have more outside activities or structured activities where they're able to have a mask break where they're more than 6 feet apart, say for a snack or nap, those types of things. And having those conversations about the schedule of the day and what the opportunities are important between families and their child care provider.
Give us a sense of how child care facilities have been doing overall with regards to things like infections or exposure rates.
So one of the things that we had updated for a request last week is I believe we had 51 total incidences of staff or children enrolled in childcare since the beginning of March. And when you think about the breadth of childcare across Pennsylvania, during the height of the stay-at-home orders, we only had about 1,500 childcare providers that operated under waiver or were exempted because of their size to operate, as opposed to just under 7,000 providers that are opening up and serving children right now. So while it's unfortunate that we have any instances, at this time the numbers are pretty low.
So if a child or a staff member were to test positive for COVID-19, what are child care facilities required to do?
So we've issued them policy guidance announcements. And first and foremost, we ask that they report to the Department of Human Services, our certification representatives that are responsible for monitoring the licensing of childcare, as well as informing the Department of Health. But in terms of their direct actions, if a parent calls after childcare is over or the child's not there, it's important that staff and other families know anonymously that there was a confirmed case of COVID-19 within that facility. Then the center should be making decisions about what length of time they might need to close based on the exposure to staff and to other children in the facility. And at a minimum, they should close for 48 hours to make sure that they're cleaning and sanitizing and making sure that the allowances for coverage and notification have occurred.
Is there an enforcement or inspections of facilities to ensure compliance with the mask wearing?
So right now, the Office of Child Development and Early Learning Certification staff monitor all child care providers annually. In addition to their normal monitoring processes, they also conduct complaint investigations. So if there was a complaint to come in that a parent or maybe a staff is feeling very uncomfortable about what's happening at a center and identifies the facility, our staff will go out to monitor to ensure that the programs are following their regulations and the guidance that we've given them on this issue.
What types of guidelines are in place to deal with children once they arrive? Is it specified in terms of how they're brought into the facility or how they can interact with each other during the day?
So we really rely very heavily on the Center for Disease Control and Prevention, or the CDC, guidelines for childcare that remain open. And they advise that childcare providers select one of 3 screening procedures that basically entails, in one method or another, either the parent or the child care provider assessing the child's temperature, as well as sort of interviewing them, the family, so to speak, to see whether or not they have any symptoms or if any of their family members are identified with any symptoms. If they are running a temperature or they do exhibit symptoms that are associated with COVID-19, they should not come to care for that day. So we are advising that screening, to the extent possible, happens outside the facility or perhaps in a foyer or a hallway prior to the children entering into the childcare space. As always, as soon as they come into childcare, they should be washing their hands and putting their personal effects off to the side and enjoying the rest of the children for the remainder of the day.
So you mentioned personal effects. Is it okay for children to bring, say, a favorite toy or a blanket or something into a childcare facility?
We've really recommended that families not bring those items into the center. If they're coming to the center, then we're working to have those left in their cubby or their locker if they're able to separate from them, and that we're limiting the transmission of items from home to the center or the child care home and vice versa.
What types of metrics or what is the department looking for in terms of maybe changing the rule back to opening up for mask wearing again?
Well, we really understand that childcare, just like any other business, is part of a community that's interdependent on each other. So as soon as children and their families return to their home setting, we really need to look at the information that is being offered to us from the Department of Health. And we really defer and make the decisions based on the recommendations coming from Secretary Levine and her team. So as long as her executive order is in place, we will be complying with the Department of Health executive order.
Now, as the state has transitioned mostly to green throughout the state, are childcare facilities open in every county?
We do have child care facilities open in every county, but what we're starting to understand is we recommended very strongly that child care directors or owners became familiar with the CDC guidelines for child care to remain open and to assess whether or not they felt they could operate in compliance with those guidelines. Also, whether or not their staff was available and able to come back to work, or whether they were having impacts from COVID-19. And finally, many providers also surveyed their enrolled families to understand whether or not there was family demand on childcare. So we know that there are some childcare providers, and as of last week, it was about 430 providers made the decision to remain temporarily closed and will notify us when they intend to reopen. We have information that since the beginning of the pandemic, just over 150 providers have permanently closed. And so as we look to how this will unravel in the future, we'll be keeping an eye out and collecting information about the operational status of childcare as a result of this pandemic.
Well, Tracey Campanini, Deputy Secretary of the Office of Child Development and Early Learning with the Human Services Department. Thank you for speaking with me.
Thank you so much for inviting us and helping to get the word out about this critical information.
Hey parents, still trying to get the hang of your child learning from home? Let us help. Civics 101, the video game, is a fun way to keep your child engaged and interested in learning about PA government. The more they learn about voting and our 3 branches of government, the further they advance through quizzes, fun reviews, and more. Start the learning today at pcntv.com. PCN, Pennsylvania Politics and Policy.
We're now speaking with Elizabeth Hardison. She's a reporter with the Pennsylvania Capital Star. Thank you for joining me.
Of course. Thank you for having me.
Now, you recently wrote an article explaining several of the different things involved in reopening public schools. When are public schools allowed to reopen?
Technically, they're allowed to be open now. So the Wolf administration allowed them to open beginning July 1st, but they have to get some things in place before they can reopen. So the big challenge to reopening schools, reporting on reopening schools right now is that Pennsylvania has 500 school districts, and they're all basically calling the shots on what they're going to do. The Department of Education has issued some guidelines and a couple firm requirements. The biggest firm requirement is that schools have to adopt what they're calling a health and safety plan before they can reopen to in-person instruction, which is the goal for almost all schools. It's safe to say that's the goal for all schools, but we're seeing that not all are able to do it all the time. So we've seen these plans kind of trickling in. So far, fewer than 100 schools, and this includes charter schools and school districts. So far, fewer than 100 of them have actually finalized their plans, and the rest we hope will be adopted by school boards this month or next month, but it is really cutting it close to the beginning of what is traditionally the school year in Pennsylvania.
Now, there's been a lot of discussion about the value of remote instruction versus in-person instruction. What are people thinking about that in terms of what's best for children and how they learn?
Well, it depends on who you ask, but there's an emerging consensus that most children do learn best in an in-person environment. So that is the stance of the American Academy of Pediatrics, which surprised some people. I believe last month it issued its kind of first statement about school reopening, and they said really schools should prioritize or try to make in-person instruction the goal for students, because of course there's the educational advantage, and we've seen some preliminary data on the 2019-2020 school year that shows that students regressed by as much as a third in their learning, more than they do over there's always some slide over the summer, but this year it's even more, and the learning losses are especially profound for poor students and students of color. But beyond the educational advantage of being in a classroom, there are all sorts of community services and supports that schools provide. So the biggest one is really child welfare kind of monitoring. And so the American Academy of Pediatrics and others are really concerned about, just the limited contact that at-risk children are having right now with like adults and caretakers. And so they want students back in the classroom so that they're, getting healthy meals, so that they have contact with mandatory reporters. Teachers have to report abuse if they think they see signs of abuse. So there are all sorts of reasons why children benefit from being in a classroom setting.
Now, you mentioned the 500 school districts, so we're probably likely to get 500 different plans.
Yeah.
But what sense are you getting in terms of the variety of the mix between, say, in-person and remote? Are we likely to see a few days a week, sometimes something along those lines?
Yeah, it's tough to say, especially because this is all happening against the bigger backdrop of the pandemic. And as we've seen, Allegheny County is currently battling a surge that it wasn't even seeing a month ago. And so these plans, the bottom line is they all have to be flexible, and they're all basically outlining kind of a wish list, like, best case scenario, we will do this. And then if we have to implement some kind of limitation, we'll do this. And then, worst case scenario, this is how we will implement full remote learning. It's a great question. How many schools? If there's a breakdown of schools doing full-time in-person, there are some schools that say that they'll be returning to school full-time in late August. Others, I'm thinking of some districts in Western, I guess kind of southwestern Pennsylvania, near Pittsburgh. There are some districts that have said we're going to do an alternating, like 2 days on, 2 days off. Students will be in the classroom 2 days, at home the remainder of the time, and kind of breaking down the student body into groups and like alternating them so that there's just less, to make space and also to allow students time at home if they need to, just limiting how many students can be in a school building at a given time. And so it's really a mix. I wish I could give a good breakdown, but again, as you say, with 500 different school districts, there's 500 plans, and it's hard to really identify any trends yet.
What types of concerns have you heard from teachers about resuming in-person instruction?
They're just nervous about going back to a congregate setting because, what we know about the virus now is that it spreads most rapidly through congregate settings where people have close contact with other people. And a school fits that definition to a T. So we know that children are less vulnerable to the worst effects of COVID-19. They can get it, but they don't get but they just don't seem to get infected as much. If they're exposed to it, they're less likely than an adult to get infected, and they don't get as ill as adults do, it seems. That said, children can still get very sick, but of course, we have I don't know how many hundreds of thousands of teachers in the state and educators who are just nervous about going back to school. And I think something like 12% of our teacher workforce is at or near the age of retirement. So that 55 and plus age bracket that we know is quite vulnerable to the worst cases of COVID.
What types of things are school districts looking at in order to try to keep staff and teachers from being close together and in groups, and some of the social distancing measures?
Well, I guess this is where, limiting the number of students in classrooms at a given time really comes in. The state guidance is really just guidance. There are no standards, no requirements for what schools have to do. But, if a school hews to the recommendations of the CDC, they'll keep people 6 feet apart. Other groups have recommended just 3 feet between students and then kind of more space between staff. But it looks like we'll see, there will be some minor changes, like students, I think a lot of students now are used to their desks being in groups or in pods, and now we'll see more rows. There might be students eating lunch at their desks as opposed to in a cafeteria. I think that schools are going to really try to, or one thing I'm seeing in these plans is a lot of schools are trying to stagger their schedules so that the hallways don't get very crowded. So, just the kind of time between periods when students are walking from class to gym class, I'm trying to limit how much traffic is in the hallway to prevent overcrowding. And then of course, places like, break rooms, teacher lounges, bathrooms are all going to have to just kind of be controlled.
Now, is the state government providing personal protective equipment to schools, or are school districts required to do that on their own?
So the state government has allocated a big chunk of Pennsylvania's CARES Act money. So they got $5 billion in CARES Act, the federal relief funding. And I don't want to give a dollar amount because I forget exactly how much money, but a lot of it has gone to schools for relief. And so schools can apply for grants and also just use their general allocations to buy personal protective gear and other things. It's the question of money is a big one right now because costs are just ballooning in a way that is really just dizzying to think about. You have the personal protective gear at the end of the day, schools will have to provide it. The state might provide funding, but the schools are going to have to decide how to spend it, how to give it out. You also have increased personnel costs potentially if you have to have like a higher complement of teachers to provide better student-to-teacher ratios. Schools are trying to get their hands on Wi-Fi hotspots, laptops. It's just a staggering amount of money that this is all going to require. And state leaders and school leaders are really looking to Congress to allocate more aid.
Now, you mentioned the plans that school districts are required to come up with and submit to the Department of Education. Is there a place for parents to go to read the plan maybe in their district?
So when the plan passes, it's supposed to be posted on a school district's website. At the Capital Star, we published just a little database, and it's little because there's not a lot in it right now, of all the districts that have approved these plans. So you can go to our website, you can see if your district is on that list. I have found that not all districts have really posted their plans publicly, or at least not in a way that's very accessible. But ideally, your district should have a plan posted to its website. And if there isn't one there yet, then it's possible they haven't voted on it, and it'll be coming up before the school board very soon, hopefully, or they adopted it and they didn't post it. So I wish there was a repository. It would make my job a lot easier, but there's no kind of central repository for these things yet.
Well, we've been speaking with Elizabeth Hardison. She's a reporter with the Pennsylvania Capital Star. Thank you for joining me.
Of course, thank you.